Welcome to Profits in Practice. I'm delighted to share Prateek from McKesson, and he's going to talk to us about the Intrafusion program. I know McKesson does lots of different things, but tell us a little bit about this program and what practices this works for.
Absolutely. Happy to. Thanks for having me.
Yeah.
So Intrafusion by McKesson is McKesson's infusion management services organization. What that really means is that we help community practices and providers remain independent. And as these providers and practices want to start infusing or providing certain infusion therapies to their patients, we come in and do all of the backend administrative stuff for them so that they can really focus on what's important for the patients, which is patient care.
Yes.
And we take all of the backend stuff dealing with insurance companies, infusing the patients, the billings, the collections. So that's what the business is. So we serve over 200 providers in the country. We have just over 100 customers across the country. And we serve, if you look at the specialties, neurology, rheumatology, infectious disease, allergy. So essentially all of the specialties that have any infusion products or drugs, we essentially serve them.
Okay. So you do all the stuff that nobody wants to do.
Pretty much, right?
And how do you think McKesson is well equipped to do that? Are you rolling out playbooks and kind of just, building on the best practices you've developed over time?
Absolutely. So Intrafusion, the organization, has been in existence for over 25 years.
Oh, wow.
Right? Yeah, exactly. It was founded in Houston by a gentleman who really sort of saw this as an opportunity early on. And so McKesson, acquired the organization about 10 years back.
Okay.
And so if you look at McKesson's overarching mission, where we really look at, it's not just a package, it's a patient for us, right? So we really are trying to figure out how do we play a role in the patient journey across various specialties, right? So obviously, we started McKesson's journey as a drug distribution organization, but over the years have diversified into oncology, multi-specialty with Intrafusion, retina and ophthalmology recently. So that's how we have sort of looked at that. We obviously have the national size and scale and expertise of being an organization in the country for over 200 years. So how do we sort of use that know-how and help our patients and our practices?
Yeah. Well, and is it best for clinics that are starting infusion for the first time, or do you also work with practices who maybe you've done it and it's like, this just isn't working as well as I wanted, or I had a nurse quit, or, tell me what kind of clinic is an ideal clinic for Intrafusion?
Both, actually. Okay. Our customers span from, doctors who have never infused in the past and are looking to diversify their revenue, stream, and also make sure that their patients get their infusions under their care in their clinics. So first time infusing doctors, but then also, to your point, medical groups who have been infusing themselves, and with the ever-changing complexities in the world of payers and these drugs are very expensive, right? So inventory management and control and waste management is so critical, right? So we have medical groups who have been infusing themselves for a long time and are struggling, so we come in and help them.
Yeah.
And then also, there are other infusion management organizations, so they might have had a bad experience with those, and so they come in as well. So we look at our customers in 3 different buckets, if you will.
Okay.
And they come in all size and shapes and various stages of their infusion management journey.
Okay. And I agree. The inventory piece is challenging. It impacts the cash flow. And ultimately impacts the patient of, getting it there in time. I think a lot of times we think of physicians, they're not into just-in-time inventory and some of these very sophisticated business practices. And so the infusion business can really shape the practice in a way that maybe they hadn't really intended to on the cash flow pressures and inventory.
Absolutely. And often the infusion business becomes the business that helps remain, these practices independent, right? Because often we all know that the reimbursement has been declining across the board for, a lot of the ancillary services. So often the infusion side of the business, it's not only a great patient satisfier, because we believe, and I personally believe, that a patient is best served under the care of their providers as opposed to another location. And so,
Absolutely. That's best for the patient. They know the nurse, they know the clinic, we know what's going on with that patient and really can provide the best care in the clinic. I 100% agree.
absolutely.
Well, talk to me about, so if I was a physician and I was interested in getting into infusions, what kind of analytics, like how would I begin that relationship with McKesson?
Yep. It's very simple. We try to make it as simple as possible for our providers, right?
Okay.
So it's as simple as reaching out to Intrafusion, obviously. But then what we do essentially is we come in and we look at the practices sort of overall census or patient population,
Okay.
right? We look at the existing patient panel that the practice has, what kind of disease states, what kind of therapies the provider has been prescribing for those patients, right? And as we all know, within the multi-specialty space, some therapies are pretty much lifelong, chronic, infusions. Some are sort of, you start the patient on some, and then it's every 6 weeks or every 2 months, depending on sort of the. So we look at all of the aspects of the provider's patient panel, the prescriptions. And we help basically build out a pro forma for them, essentially, a
Okay.
financial view of what a 3 or 5 year outlook looks like. And that's all. So what we need from our providers is very simple information, as in how many patients are on what prescriptions. And then we also look at sort of their growth trajectory in terms of how many new patients they're bringing on and all of that. And then we basically crunch the numbers and then, show them what an outlook might look like.
Yeah. Don't make it sound that easy. It's not just crunch the
It's not
numbers.
that
There's a
easy.
lot that happens on the backside of that. But yeah,
Of course.
you're having a business discussion. I don't want to say we, you and I definitely agree. It is best for the patient. And so how can we also make it work for the clinic financially? And we don't want to be starting any type of new service that's a loser.
Absolutely.
Talk to me about like the prior authorization and denial process. I mean, that's all part of the partnership as well.
Huge.
Yeah,
Absolutely.
and huge. It's vitally important. I think sometimes we're like, oh, it's just a denial. I'm like, no, that's like dollars that are gone if you haven't followed the process.
And it breaks or makes a practice, right?
Absolutely.
I mean, one drug, for example, if one therapy a practice infuses without an approved prior authorization can honestly result in major repercussions for the patient, right? The practice and the provider, because the providers have to provide personal guarantees, obviously, to get distribution accounts and things like that. So how we support the practices and ensure that the intake, the benefit verification, the prior authorization process is airtight. Intrafusion uses its own proprietary tech stack.
Okay.
It's called Intrafusion Pulse, right? Is one of my babies that we found that when we saw the patient journey, right? It all begins with ensuring that we have the right information from the patient in terms of their insurance information.
Yes.
And then very timely from the time of prescription, when the doctor writes the prescription, our team jumps on that prescription within minutes and essentially begins the process of, benefit verification, ensuring that is the drug covered by the insurance company of that patient, right? If not, what are the options, right? And then ensuring all of that, really understanding the patient financial, counseling piece. We have an entire team that, focuses on finding the right foundation. If the patient has a highly significant out-of-pocket cost, we work with an organization that has automated, all of the foundation grants because normally for folks who might not know, the foundations are all manual. You have to pick up the phone and find out, right?
I thought it was a paper form. You're talking about the phone. That's one step. Yeah, it's a very antiquated. They do excellent work, but they don't have sometimes the resources for the technology. So that sounds like a great platform.
Absolutely. So we have integrated all of that to really, for that disease, for the right drug, which foundations have any grant money left, so that we can really paint a picture for the patient. And then our call center calls the patient, lets them know that, here's what the total cost would be for their entire treatment regimen. Mm-hmm. We schedule the patient comes in. We talked about the inventory management, right? So our team of inventory managers, they essentially order the drug just in time for the patient to come in, because they can see.
Well, they have access to you, right? Like you can see, okay, we're going to pull it from this warehouse or this distribution center. Yeah,
exactly. And then our nurses are the ones who, on site are the ones who are sort of mixing the product. and infusing the patients. They do the pre-infusion, counseling for the patients, post-infusion, observation and management and care
Notes
management,
and
notes and all of that. AI is a buzzword. We have ambient, scribing now
okay.
at all of our clinics. So it all begins with that technology. So our secret sauce is Intrafusion Pulse, which allows us to, automate the patient journey. We have risk mitigation parameters in our tech. So for example, we talked about if you infuse a patient without an approved prior authorization, that means you're not going to get paid.
Right.
You're talking about sometimes $30, $40, $50,000 worth of drugs,
Sure.
right? So our nurses can't schedule a patient without an approved prior authorization that is embedded in our system, right? So that's a safety mechanism we have built from learning over the years.
Some
Right?
tire marks, right? Sometimes you got to make a few mistakes to build
Absolutely.
in.
And
Like
we
I
have
know,
made our
yeah,
mistakes.
yeah,
Yeah,
absolutely.
yeah.
Well, when you're talking about the nurses, especially for a clinic that's new to infusions,
Yeah.
they're not there for 40 hours a week, right? I
No, they're
mean,
not.
you can you have the ability to shift. It's like, okay, Monday is going to be infusion day, or tell me a little bit about how that model works.
Absolutely. And that's, again, is one of our secret sauces. I think we are one of the organizations in the country who has a bench strength of over 200 nurses. So we have nurses that are, obviously, are on our payroll, but then we have travel nurses, we have PRNs, and depending on
Okay.
certain states which allow, LVNs and LPNs, so that's also a model. So what we essentially do is for practices which are infusing 4, 5 days, often 6 days a week, that's easy. You can dedicate a full nurse. Often for those practices who are just starting, that's where the PR and the travel nurses come.
Okay.
Right. We also try to figure out, because we if, like, for example, in the state of Texas, Florida, we have heavy concentration of practices close by to each other across multi-specialties.
Okay. Yeah.
So what we do is we try to sort of ensure that if we have a nurse who's infusing, let's say, in the northern part of Dallas, and then the same nurse can go to South Lake and infuse there. So really try to optimize not only the patient experience, but then also the cost,
Yep.
right? Because nursing is a heavy cost.
Yep.
It's the biggest line item in my P&L, in any practice's P&L. And there is a nurse shortage in the country, as we all know, right? And the great thing about our model, Sarah, is that we are true partners for our practices, right? Every dollar that flows through the P&L essentially is beneficial to us and the practice and to the patients, right? That's why it's a true partnership, skin in the game. So we all benefit from keeping our operating costs as low as possible, ensuring that there is coverage for our patients.
Yeah.
So that's how we sort of manage the nursing equation.
Yeah. No, I think that's smart. And I do like that it is a shared partnership. You both have skin in the game. Like it needs to work for everyone.
Absolutely.
Talk to me a little bit about the reporting. So let's say, I've got my infusion suite. I'm rocking and rolling. We've worked out the kinks because it's launches, no matter how much you plan, they're still like, okay, we didn't know that this person was lefting. I mean, whatever it is, there's always something there. But we're smoothly, we're bringing in more patients. What kind of reporting? Like, do I get a report each week as a physician or monthly? Talk to me. What does that look like?
Absolutely.
Or can I go into Intrafusion Plus? I mean, right there at my fingertips.
So combination of all three, right? So we have a self-service reporting portal for our practices. So every month, whole sets of reports, including financials, volume information, which drugs were infused, what was paid, what's outstanding, how much we're collecting. So we have a set of reports that practices have option to self-serve portal. First week of every month, that gets updated with sort of the previous month's utilization and financials. So that's one option. Second, on a weekly basis, depending on the practice's volume, each practice is supported by 2 individuals, right? So that's our operating model. We have a strategic account director assigned to every practice. They are sort of, quote unquote, the CEO of the practice from our side. They are the ones who are sort of looking at the practice's profitability. They are the ones who are working with, let's say, a practice administrator or manager at that practice on a weekly basis to ensure that the business side of the practice operates smoothly. And then we have a clinical operations manager. Normally a nurse, mostly a nurse leader who's assigned to sort of oversee the clinical aspect of the practice's operation, right? So the nurse on site normally reports to that clinical manager. So between those two sort of leaders from our side, the practice has access to that monthly reports binder, as well as the weekly reports, which is more sort of forward looking, which patients are coming in that week, what to expect for those patients. So that's sort of how we have structured our reporting. Now, obviously, if there are any bespoke custom requirements from each of the practice, we take that into account. We are supported by McKesson's analytics team. we have a dedicated 5% team to support our entire reporting operation. So they are obviously there to help any practices if they have any specific requirements outside of our normal reporting.
Sure. Sometimes it's like, I know this data is in there somewhere. I just don't know how to pull it exactly from the report. So that's great that you have that resource. Um, Talk to me about payer contracts. So you're in the business. You're a partner in the business.
Yes.
Sometimes I see opportunities. I'm like, this contract hasn't been renegotiated in 10 years.
Yeah.
I mean, there's a lot of reasons for that, but that's something that Intrafusion can help the practices with as well. Not just on the infusion side, right? Like, can you look at the entire practice?
We can.
Okay.
And we have two solutions for that. So one is we have an advisory team.
Okay.
That can come in and sort of review the contract, sort of, understand a little bit of the benchmarks and the geography and, to the extent possible, advise the practice in terms of here's what you should be doing if you want to negotiate, right? We don't directly negotiate on behalf of our practices, right? For that, we outsource it, right? So we have a list of preferred vendors, and so that's how we structure it. So when it comes to advisory and sort of guiding our practices in terms of, to your point, if they haven't looked at their contract, some of our practices, you'd be surprised, don't even have access to their contracts.
That's actually, I was helping a team and I was like, okay, share with me all your contracts. It almost took us 6 months just to get access to all the contracts. We found an old piece of paper that had an address and you had to snail mail a request. So getting access to those and, it's always a best practice to keep all that stuff. But as technology changes and staff changes, those are sometimes hard to track down.
Absolutely. So that's how we support our practices. And what we do, again, using our technology is really ensuring that our practices actually get paid what they have negotiated or what's in the contract, right? So we load the fee schedule of each practice into our system. And so that's when we sort of look at, all right, we have gotten reimbursement for a product, is it overpaid, underpaid, right? If it's underpaid, then we have an entire team that's focused on, again, going after the insurance companies and ensuring that we get paid what we're supposed to get paid. So again, that's how sort of the importance of those payer contracts, right? So first step is to get the payer contracts and then optimize it. So we depending on the practice's journey.
Some of these things take a lot longer. It's some things that I'm like, man, this should be so simple. We should be able to figure this out really quickly. It takes a long time just turning the wheels. So I love the use of technology because I think that's sometimes where I see practices, they're not designed to be technology experts, right? They're not these hubs of thought leadership and technology, nor should they be. But sometimes we have some really antiquated practices just because we haven't been keeping up to date on things. Or, you had a bad experience with one EMR and you're like, I'm never changing EMR. Like you kind of have this adversity to that. So I love that your team is bringing in, the technology and using it in really thoughtful ways to build up the practice. So
thank you. And the one thing I'd say is what we have tried to do is, we don't go into a practice and say you need to even use our technology. Practices keep their own technology, whatever EMR they are on. We don't expect them to change anything at all. We come in and only our team uses our Intrafusion Pulse technology, and we integrate with the usual EMRs out there, right? And if a practice is using a very specific EMR that we have never had an API integration with, we create a manual process to get the patient information that we need to start the, our portion of the workflow. So we keep it as simple as possible for the practices.
Nobody has time to learn another system.
Exactly,
so that's great. Like they get to use a lot of their own technology.
Absolutely. So they keep their own. We don't change their workflows. We come in and use the technology in the background. And it's completely sort of, seamless as possible for our providers.
Yep. As we're wrapping up, what advice would you give to a community clinic that is interested in getting into infusions?
The one piece of advice that I always say that how we started, right? We firmly believe, and I'm sure the patients and the providers believe that patients are best taken care of if they get their infusions under the care of their doctors, right? Doctors who are apprehensive about getting into infusions, we all know why, right? It is very difficult to do. The cost of drugs is very high. It's a lot of financial burden and administrative burden for our providers. And that's the whole reason we Intrafusion exists, to ensure that it is as seamless and as easy as possible. So the one piece of advice is that if we all believe that clinically it is the right thing to do for our practices and our patients, talk to someone like us. And doesn't have to be Intrafusion, but there are many others out there. I think the mission is very simple, right? Access is critical for these patients. Getting on therapy as quickly as possible is critical, because often if these patients have to go to other, large organizations where, sometimes you have to wait 20, 30, 40 days to get on therapy, it could mean the difference between you controlling your new diagnosis very quickly versus letting it escalate. So that's what I would say. If you're a new provider who's wanting to start infusions, because the pipeline is rich within neurology, within immunology, give us a call, or give, one of my peers a call.
Yeah, absolutely. Well, thank you so much for joining us today. I think we all learned a little bit about infusions and more about how it is. We definitely agree. It is 100% the best outcome for the patient to be there and be served by their physician, and how to make it practical and have it implemented into the practice.
Absolutely. Thank you for having me.
Yes, thank you. Thanks for joining me on Profits in Practice. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with a fellow physician. Your financial wellness is just as important as your patient's health, and we're here to help you thrive. Connect with us via our website at webcfo.com. Thanks for joining us.